This is Chapter 33, Promoting Reproductive Health, Common Reproductive Cancers. The majority of this chapter focuses on cervical cancer. We will talk about a couple of different ones at the end of the chapter, but the majority of the chapter is about cervical cancer. So the cervix and the cervical transformation zone, you can review these on your own. This is on page 1018, and there's also figure 33-1 on page 1019. So cervical cancer, it's growth of cervical cells that starts in the cervix. It's most commonly caused by HPV that we just talked about in the previous chapter. This is the second most common cancer in women. So that's why this is such a big concern for women to develop cervical cancer. Risk factors. So you can see all these risk factors here. I won't read all of these, but you see HPV infection is listed there. Obviously, there's others, early onset of sexual activity, inadequate cervical screening, multiple sexual partners, oral contraceptives. You can read all of those. You can also look at page 1019, box 33-1, and that shows you risk factors as well. So symptoms. Early cervical cancer usually does not show any symptoms. So they may not experience any problems or even notice anything is wrong until the cancer is advanced and has already spread. So this is why education on the importance of routine cervical cancer screening is so important. And there's a patient education box on 1020 that talks about that. But that's where we come in as education to explain to them why it's so important, because really it's not going to be picked up because they're not going to have any symptoms initially. So let's talk about screening and early detection. So the goal is to detect the cervical cell changes before any symptoms develop, because usually by the time the symptoms develop, remember it's late advanced stage, and it's usually spread to other areas. So we want to detect those changes as early as possible. So screening is performed by a Pap test or a Pap smear, in which the cervical cells are collected and then they're examined for any changes. So this is when a woman goes to her yearly exam and they do that Pap test. It's recommended to begin screening at 21 years old, regardless of their sexual activity. So you can look at those current screening recommendations bullet points on page 1022. So for adolescents, it's not recommended for cervical cancer screening prior to 21, so not really for adolescents, but we should be educating them on safe sexual practices and contraception, as well as encouraging that yearly STD testing or anytime they may be concerned about that. In older women, cervical cancer rarely occurs in women younger than 50. So rarely occurs in women younger than 50. So it's recommended that obviously they get screened, but once they reach 65 years old, they can cease those cervical screenings, especially in those that had previous adequate screenings and had negative results. By the time they reach 65, they can stop having those yearly screenings. So let's continue talking about the screenings. So there's different types of things that can be used for that screening and early detection. The Bethesda system is the way that the cytology findings are interpreted, and you can look at the terminology on page 1023, box 33-2. Follow-up, so if it's an unsatisfactory result or if they notice any abnormal changes in the cells, they will notify the patient, and then they need to follow up. So there's different guidelines based on what they determine and what they see. So you can look at box 33-3, page 1023, to determine what those guidelines are for follow-up care for that abnormal result. A colposcopy is a diagnostic procedure. So if they have an abnormal Pap smear, they may schedule a colposcopy, which is a diagnostic procedure to better visualize the cervix. So a lot of times that will be done after an abnormal Pap smear, or even if they have a positive HPV test, they may do a colposcopy as well. So the next step after that is, if the colposcopy is unsatisfactory, they will perform endocervical sampling, and this is performed by vigorous endocervical brushing or curettage to collect those cervical samples. So those are different options that can be used. Management of abnormal cervical cytology or colposcopy findings. So what happens if they do the abnormal cells, they find the abnormal cells on the pap smear, the colposcopy shows the same. Now what do we do? So there's different options. There's cryosurgery, which is freezing of the cervical tissue. There's laser ablation, which is a high energy beam of light that vaporizes the abnormal tissue. And then there's conization, which is excision of a cone-shaped or kind of a cylindrical wedge from the uterine cervix. So there's different options, and obviously depending on what's happening and how severe it is, they would give her information about these different options. You can read further information about these three options on page 1025 to 1026. Diagnostic workup and treatment of cervical cancer. So radiation therapy, obviously we've all heard of radiation before. It uses high energy X-rays to destroy the cancer cells. So that would be an option. They could do external radiation or internal radiation. External would be a beam, and then internal would be placement of that radioactive material as close as they can get it to the tumor. So that is an option as far as treatment of cervical cancer is radiation. Other treatment options would be surgery. We talked about the conization earlier. They can also have a radical hysterectomy. Remember, we talked about that in the previous chapter, what that means. And obviously chemotherapy. This is used when the cancer has metastasized from its original area. And they would obviously recommend chemotherapy at that point. So you can also read more in depth about this on page 1028 to 1029. HPV DNA testing. So remember we talked about HPV, and most of the time infections are asymptomatic. So routine pap tests are imperative for diagnosis, and because they may not have any symptoms, so that pap smear is going to show up that they have HPV. There's also an HPV DNA test that can be performed on the same sample, and they're looking at those exfoliated cervical cells, and they're looking for those cancer-causing HPV that's detecting that virus, basically. So you can look at that on page 1031 if you'd like to read more in detail. Potential manifestations of an HPV infection. Obviously, abnormal findings on the pap screening. Only 1% of those infected with HPV develop external genital warts. So this is why it's so important for them to have that yearly screening. And you can continue to review this on page 1031 to 1032. So what is our role as the nurse in reducing patient risk for cervical cancer? So once again, education is a big part of this. So discussing the risk factors, if they've had a sexual partner more than 2 years older than them, if they have more than 3 lifetime sexual partners, if they've had a new sexual partner in the past 12 months, if they've had illegal drug use in the past 12 months, if they engaged in intercourse while impaired by alcohol, if they've never been married, and if they have had a male sexual partner who is not circumcised. So it's important to educate them on these risk factors and helping them identify those things that may be pertinent to them and getting those screenings. And obviously we talked about the HPV vaccines prior. So Gardasil, that's the most common one people recognize. And those are the ones that are recommended now. Gardasil and then Cervarix is the other one. And you can review that vaccine information on page 1033. Remember, we also talked about vaccines in the pediatric chapter, okay, when we talked about the growth and development. So specifically for adolescents, how important is this as far as education for HPV in adolescents? So education should target both genders. We don't have to talk to just females because males can have HPV as well, and it can cause long-term effects for them as well. Developmentally appropriate information should be used, so we don't want to go in and talk about big words. Okay, we want to use language they can understand, and be able to explain whether it's a younger adolescent or an older adolescent. We need to listen attentively to them and their concerns and be able to explain things that we need to explain to them and that they may not understand. Obviously, we remain focused and we avoid lectures and writing during the conversation because adolescents, especially this age of adolescence, they're not into talking and writing as much. It's more, the technological age of videos and games and things like that. So that would be more hitting on their level of education. Okay, so all of that was about cervical cancer. So now let's touch on a couple more different types of cancers. So ovarian cancer, it is the leading cause of gynecological deaths in women, and it is actually the fifth most common cause of cancer, okay, in women. Signs are very vague with ovarian cancer, so usually they're not going to start having those signs until late in the development of ovarian cancer. So the diagnosis is not made until late, and the cancer is actually metastasized. So that's one of the main concerns with ovarian cancer. Endometrial cancer. So this is the most common gynecological malignancy in the United States. It is rare in women under 40 years old. There's only about, most of those cases, about 70% of the cases will be in women 50 to 69 years old. So very rare for women under 40. Risk factors include estrogen therapy, nulliparity, early menarche, late menopause, which it means they go into menopause after age 55. If they've had therapy with tamoxifen, they've had infertility issues, diabetes, gallbladder disease, they've had PCOS, history of ovarian tumors, hypertension, diabetes, and obesity. And treatment for endometrial cancer includes a total abdominal hysterectomy, along with removal of the fallopian tubes, the ovaries, and lymph nodes as well. So it's going to be a pretty extensive surgery that they're going to have to rid that endometrial cancer. Premalignant and malignant vulvar lesions. So you can review these on your own, page 1036. There are different types. You don't have to know all these different types. I just want you to kind of realize that there are premalignant, and malignant vulvar lesions as well that can occur on the vulva of women. So page 1036, you can review that. And that's the end of chapter 33.